Remember to subscribe Happy Parenting and click the bell icon for more videos.
Irregular period after pregnancy, causes and cures. When a woman gets pregnant, her periods can often change from regular cycles to irregular ones. Some women face a change in their period after giving birth. Some women feel their periods have become easier while others experience more painful periods. The most common change is the length of your period cycle. Your period may last shorter or longer than usual. What causes irregular periods after pregnancy? 1. Weight gain. When you gain weight after pregnancy, it causes your uterus to expand. This expansion can lead to heavier periods and other changes in your period cycles. You'll probably get an increase in your period every month, but some months you'll skip a couple of days and some months you won't get any at all. 2. Lack of exercise. Being physically active can help with hormonal changes during pregnancy. After you give birth, however, many mothers feel too tired or exhausted to get back in shape. 3. Breastfeeding. Women who are breastfeeding for the first time can have irregular cycles. They can also have heavier periods than they used to. The extra hormones produced by nursing may make your period heavier. 4. Stress. Stress can be a big factor when it comes to irregular periods. If you're stressed out about anything, your body will try to compensate by making the changes it needs to in order to deal with that stress. So if you have more stress in your life than usual after pregnancy, it can lead to irregular periods. 5. Altered hormone levels. Hormones play an important role in regulating menstrual cycles. The levels of estrogen and progesterone during pregnancy can also influence what happens during your period. How to deal with irregular periods. 1. Exercise. Exercise is an excellent way to relieve stress, and it's also great for your body. Some research even suggests that exercise can help prevent breast cancer after childbirth. 2. Managing stress. If you're stressed out, it can actually lower your testosterone levels, which can in turn affect your menstrual cycle. If this happens, you may notice more frequent or longer periods. 3. Proper diet. What you eat plays a role in your hormones, so a well-balanced diet can help keep your cycle regular. Eat lots of vegetables and fruits and avoid junk food and sweets. 4. Get plenty of sleep. Sleep is essential for hormonal health. A lack of sleep will cause your body to produce higher levels of stress hormones. 5. Preventing anxiety. Anxiety can sometimes cause your ovaries to produce too much estrogen, which can result in more bleeding. Try breathing exercises or other relaxation techniques to manage your anxiety. 6. Try alternative therapies. Talk to your doctor about alternative therapies such as acupuncture or hypnosis. These methods have been used for thousands of years to treat a wide range of issues. 7. Try natural products. Some natural products can be helpful for balancing your hormone levels. For example, a study conducted at the University of Arizona found that those who use the herb black cohosh experienced less menstrual blood loss than women who did not use it. 8. Keep track of your symptoms. Keeping track of your symptoms is a great way to make sure that your periods are regular. If you find that your cycle is off, try to see if there are any patterns in when your symptoms occur. In the following cases, a female should see an OB-GYN. 1. Heavy vaginal bleeding that lasts more than 2 hours can be caused by 1 pad per hour. 2. Fever. 3. Cramps. 4. Period blood has large blood clots. Thanks for watching. If you like the video, don't forget to like, share, and subscribe the channel.